In today's program, Adriana Curado from the Portuguese activist group on treatments will tell us more about the group's activities and how the organization helps people improve their health, rights, and quality of life. We met with Adriana in London and asked her a few questions. Let's hear what she had to say. Adriana, as a member of the Portuguese activist group on treatments, what is your role within the organization?
I have had many roles over the years because I work in GAT for 12 years. But I'm primarily linked to harm reduction interventions and programs with people who use drugs, illicit drugs. And now I have moved because I've been a scholar in the Tobacco Harm Reduction Scholarship, and I had the opportunity to work for the first time in tobacco and nicotine, with the tobacco and nicotine as a substance. And that was amazing. I was a smoker. Now I moved into the heated tobacco and also vaping. So it is personal and professional at the same time. So I'm very happy to be here and to listen to all these contributors, and it's amazing.
Okay, so what are the main goals of the group's activities in relations to public health?
So GAT is a HIV community-based organization, and we work with the very different groups and communities affected by HIV, which includes people who use drugs, men who have sex with men, migrants, people engaged in sex work. So a lot of different and diverse communities. We have different services, but our focus is on HIV prevention, testing, and linkage to care. And we are very much and very strong on these activities, but at the same time, we also engage drug policy reform and harm reduction services as well. And we aim to expand access to healthcare, also access to the best prevention tools and treatment options. And we have also a focus on anti-discrimination, anti-stigma, and to empower people and to give voice to the communities.
And which areas does the organization operate, and which primary groups benefit from support?
So we work closely and directly and with people from all these communities I mentioned. And these are mostly communities affected by HIV and viral hepatitis, and mostly people who use drugs, who inject drugs, people who are engaging in sex work, or transgender people, men who have sex with men. So all these we have different services, and the services sometimes are targeting more one of these populations.
Okay, and the last question to you, Adriana. What legal and policy changes do you advocate for to improve the health and quality of life of people living with HIV?
So GAT has these all services in prevention and testing and linkage to care, but also is involved in a very political discussion and policy in the policy side, especially regarding to access to health, to the best treatment and prevention options, and also in health policy reform and drug policy reform. And is also why we are interested in tobacco policies. We are working with some of the communities most affected by tobacco smoking. So it's in our interest that people have access to safer products. And that's it.
Great. Thank you so much.
Thank you.